And without further ado, I am pleased to welcome and introduce the Mayor of the City of Houston, Mayor Sylvester Turner, who celebrates and congratulates you on this tremendous accomplishment.
Thank you. Thank you, Director Stepetch. And let me just say to University of Houston, good morning, Cougs. And I'm just honored to be with you and excited about this graduation this morning. Look, I'm honored to spend time with you in this Community Health Worker graduation ceremony and a recognition of the Community Health Education Fellowship or CHEF program. And Juliet was very gracious in her introduction of me, but she was instrumental in the work that we have done in this area. So I want to thank her and certainly want to thank University of Houston for everything that you have done and continue to do. I want to congratulate you on successfully completing your studies, obtaining your certification, and completing a hands-on externship program, helping our communities during this unprecedented pandemic. I also want to thank your family, friends, and loved ones for helping you reach this very important milestone. You have overcome tremendous obstacles given COVID-19 to succeed. You are a tried and true certified community health worker, educating and empowering our communities to remain healthy and safe. And I want to say thank you for that. COVID-19 has affected every single facet of our daily lives. Its morbidity and mortality have been unrelenting in heaping physical, social, mental, and economic challenges. Houstonians, especially our most vulnerable, are trying their best to overcome misinformation, health issues, economic hardships, and instability on this long, difficult road to recovery. When COVID hit, I wanted to empower our communities with public health information to keep our loved ones safe. Instead of a top-down approach, I wanted to creatively work with persons from the communities to develop a grassroots community-led program to share critical public health information to build and sustain trust in neighborhoods mostly impacted by COVID-19. I wonder what kind of healthcare hero could help us with this innovative effort. And you know what? It turns out it is you, the community health worker. The University of Houston was already leading the way with this community health workers initiative that so wonderfully partnered with my Community Health Education Fellows program. Your participation in this program means that together we can enhance the health and resiliency of our community while honoring and including the unique mental, physical, and spiritual health needs of our diverse neighborhoods. As a certified community health worker, you have an opportunity to learn and work with our vulnerable and underserved populations, helping to educate, build capacity, and answer questions during the COVID-19 crisis. Your projects and research are helping the city better interact and respond with the diverse stakeholders in our community. And I want to thank you for making this decision and putting forth the effort to be a frontline healthcare worker during a global healthcare crisis. We need your passion, your talent, your creativity now more than ever before. When I launched my Health Equity Response Task Force in April 2020, certified community health workers became a cornerstone of the city's COVID-19 recovery efforts. Under the leadership of my Office of Education and the HER Task Force Public Health Education Subcommittee, we developed the CHEF program. We focus on recruiting persons 18 and older from Houston's neighborhoods determined by CDC data to have the greatest vulnerability to COVID-19. We focus on working with 17 priority super neighborhoods and 10 communities from my Complete Communities initiative. Everyone knows, as Juliet has indicated, that I'm from Acres Home. I grew up there and I continue to live there. I know the streets, the businesses, the churches and parks, but more importantly, I understand and love the people. It's my neighborhood, and I wanted the chefs to be from our communities so they can carry that deeper, more authentic and personal connection. understanding and appreciation of their neighbors and their spaces. The buy-in is stronger, and so too is the investment in the place you grew up. And now you are equipped with the knowledge, the training, and skills to educate and empower your own neighborhood in the fight against COVID-19. You know what? I am so pleased to see what we can accomplish when we work together. This is what makes us Houston strong. And back in April, when we piloted the COVID-19 Community Health Education Fellows Program in partnership with JP Morgan Chase, we set a goal to educate, empower, and employ 100 community health workers to help the city of Houston fight COVID-19. And as we sit here today, we exceeded the goal with 119 community health workers who have been a part of the Chef Initiative. We have hosted several cohorts and over the past 8 months, and I am deeply grateful and proud that my alma mater, the University of Houston, came through with the last cohort of certified community health workers to participate in the Chef program. We are working together to do the hard work to build a better tomorrow. And you have been promoting public health education, researching, analyzing, reporting, interacting, calling, door knocking, and helping us in ways beyond measure to respond to COVID-19. We are better today because of the healthcare workers. You have also been addressing mental health and stress management, maternal support, youth mentoring, workforce, and other areas that are critically vital to helping our communities not just survive, but thrive. And you have successfully learned to coordinate with communities, businesses, healthcare providers, and faith-based institutions to create everything from healthcare fairs to supply drives with a special focus on public health education. You've taught persons to mask up, wash your hands, and practice physical distancing in an humble and respectful manner. And with news of the COVID-19 vaccine on the horizon, I'm going to need you to help us combat the fear and misinformation about the vaccine. I want you to know, you are critical to our success. And I want to underscore that. You are critical to our success. We are surely blessed by your dedication and devotion to Houston. And so I celebrate and thank you for saving lives and bringing forth a better, healthier, and more resilient tomorrow. Congratulations. And look, I just want to say thank you to University of Houston. Thank you so very much, and go Cougs.